Hello, hi viewers, this is Ijaz Hidayat once again with you with a new topic. Today I'm going to discuss about the blood. So blood transfusion, why we need to transfuse the blood. Actually, this presentation is prepared by one of my best friend, my colleague, Sadiq Abrub. I'm right?
Yes, you are right.
Yeah, thank you so much. And we're going to talk about this presentation, going to work on that, why we need to transfuse the blood to the patients, especially in a cardiac surgery. So let's start. I have no conflict of interest as this is the word by Mr. Sadiq. So what is blood? First of all, we need to know what is blood. So as per can you just make a close to the screen also? The blood is a fluid connective tissue that consists of plasma, blood cell and platelets. It circulates through our body, delivering oxygen and nutrient cells and the tissue. So the role of the blood is to provide oxygen to keep alive our tissues. So this is the major transportation of oxygen is happening over the blood. Hope it is clear. So next, what are the components of the whole blood? So there is two components of the whole blood. If you see, I'll go through. For example, we withdraw the blood from the patients. We take it in the ampule. We're going to centrifuge the blood, and you will see there is a two compartment here, the yellow and the red. So the yellow part is the plasma, which is almost like a 55% of the whole blood, and the reddish part you will see this is like elements. So elements consists of the buffy cores like leukocytes, platelets, erythrocytes. So it is almost like a 45% of the whole blood, and plasma is containing like a nutrients, factors, blood clotting factors, albumin, fibrinogen. So all even the water all was in the plasma, and in the buffy coat we have the elements like a red cell, WBC and platelets. Hope it is clear. So there is a group of the blood transfusions. So I just want to some share knowledge by my colleague who's capturing the movie, who's doing the great role, and although he's the presenter of this presentation. So actually we have Abo Blood Group.
Yes.
So would you like to explain, Sadiq, what is Abo?
Abo, it means like if the blood has A antigen or B antigen, that means the patient group A or group B.
Yeah.
And if he has both antigens, that means
the patient has the AB. Yeah.
And if the antigen is absent, that means the patient is O.
Is O,
group,
yeah.
Group O.
Okay, so mean ABO is the blood group. So yes. Blood can be the A positive, it can be the B positive, it can be A negative, A positive.
Exactly.
Why we say the A positive, A negative, or B positive or B negative?
It's about the RH system.
RH factor.
Yeah.
So if RH factor is present, it means positive. If RH factor is not present, is absent,
negative.
So it's a negative.
Yes, exactly.
So now we'll see, for example, we have A positive blood.
Yes.
And the donor can be the A positive and AB positive, because here we already have the A positive can be the A positive and AB positive. Receiver, who can be the receive the A positive blood? A positive, A negative, O positive, O negative. And similarly, O positive, the giver can be the O positive, AB positive, B positive, AB positive, but the receivers are only O positive and O negative. Sorry.
Yes.
So what are the universal donor?
The
O positive is your universal.
O positive is
and who is the universal
giver?
Yes.
Exactly, and the general receiver is AB positive.
Yes, true. So hope it is clear for the blood grouping.
I hope
so. What is blood function? So the function of the blood is transporting the oxygen and nutrients to the lung and to the tissue, as we mentioned before. Similarly, we performing the blood clots to prevent the excessive bleeding or blood loss. Then requiring the cell and the antibodies that fight against the infections, bringing waste products to the kidney and liver, which filter and clean the blood and regulate the body temperature. So these are the functions of the blood. So blood transfusions. So it is a specific process of administering the blood and blood component from one person to another person, and there is a policy. Every hospital have their own policies. Similarly, so you apply the policy which is in your hospitals and go through with that. So the purpose of blood transfusion, the major, why we need to transfuse, why we require the blood transfusion. The purpose of blood transfusion is to replace the blood loss during the surgery and serious injury, to restore the oxygen carrying capacity of the blood, to provide the plasma factor to prevent the or treat the bleeding, major injuries after an accident or disaster, surgery on an organ such as the liver or heart, severe anemia, bleeding such as the hemophilia and thrombocytopenia. Clear? So when the blood required to transfuse, so there is a factor why, in which situations we need to transfuse the blood. So the main target, if your hemoglobin is below than 7.5 gram per deciliter, patient is anemic, or we can say there is a massive hemodilution during the surgery, or you transfuse more crystallite and your hemoglobin concentration come down, or either there is uncontrolled bleedings. So the purpose of blood transfusions, number if the patient is anemic, patient hemoglobin is low than 7.5 gram per deciliter, patient in a surgery and you transfuse more crystallite and there was a massive dilutions,
like in cabbage case,
like cabbages case, cardiac surgeries cases where you require more transfusions, and there is a chance of blood transfusion because of the coagulopathy or massive bleedings. So these are the factors where we require the blood transfusions. How we can order the blood from lab, from blood bank to the in your OR or in the where you require to transfuse the blood even in the ward. So you should include the full patient details with the name, date of birth, gender and patient health card numbers, or we can say the medical record number of the patients, where the patient locations, type of the blood component requested and the number of the unit needed, patient last transfusion history, patient clinical history. For pre-operative patient should including the date and type of the surgery, initial of the person collecting the blood, date and time of the blood collections. So these are the very important factors where we have to look at. And the timing of administrations, what we have to do, first especially for the PRBCs. PRBC mean packed red blood cells should be administered as quickly as the patient tolerate. Total duration should not exceed more than 4 hours for the PRBCs. So within 4 hours you need to transfuse the blood. For the platelets and plasma, you should be given within 30 minutes, but the total duration should not exceed more than
4 hours.
So it is clear. So you should not exceed more than 4. You have to transfuse within 4 hours, especially for the PRBC. But for the platelets and for the plasma, you can transfuse within
30 minutes.
But it should not exceed more than
4 hours.
4 hours, yeah. So before blood administrations, check number 1, just check the blood component has been prescribed. Number 2, undertake the baseline observation. Number 3, undertake the visual inspection of the blood and blood transfusion. Number 4, make sure the personal protective equipment is available and is clean and sterile. Prepare correctly the completed prescriptions chart, observation chart, giving set, disposable bags. So there is 3 checks, major 3 checks. So you have to follow the major 3 checks before transfusing the blood. First check is patient identification on the wristband, 2 identifiers, the medical record number and patient's full name. Number 2, second check is your physician's orders sheet and verification of the signed, informed and consents. Number 3, check the compatibility, traceability, label with the blood bag, label blood transfusions. Any discrepancy, do not transfuse the blood. The care and the monitors. Number one, should closely monitor the patient for the sign of potential complications. Report and document immediate any side effects, like example, during this transfusion, the patient
skin rash,
flushing, shortness of the breath, back pain, or the pain in the extremities. So if anything happened, please stop transfusion and report to the physician. In case of the hypothermic cases like surgeries, if the patient, we already decrease the blood temperature of the body. So for transfusion, you need to warm the blood and then transfuse to the patient. Okay. Number 4 is monitoring of the vital sign, especially in the first 15 minutes of the transfusion. So when the time you transfuse the blood, you have to monitor the patient's vital signs at least first 15 minutes. So patient is stable, it's okay. In case of the complication of the blood transfusions, in case of there is a minor reaction, so minor reaction can be skin rashes. You will see the rashes on the skin of the patient. Severe allergy, skin rash plus respiratory distress. If in case of the patient have the severe allergy, so there you will find the skin rashes and plus respiratory distress. So patient is getting a difficulty to breathe. Number 3, anaphylactic shocks, hypotension, respiratory distress, bradycardia or tachycardia, then isolated febrile reactions, transfusion associated circulatory overload, TACO, or transfer-related acute injury, lung injury. So what is the management of in case you have the blood complications? So number 1, in case you notice there is a reaction during after blood transfusion to the patients, stop transfusion.
This is the first step.
Yes. Now ask for help. Just call, we need help with the patient having reaction of the blood. Then provide 100% oxygen to the patient, so you keep the patients alive in a good condition. Then send 5 ml of the blood and the rest of the blood back to the blood bank and call to the blood bank and the lab so they can check what was the problem behind why we get a blood reaction to the patient, and collect the patient urine also to check the question and infection of the patients. So in case of the minor allergy, so these are the drugs which is available. So in case of the minor allergy, so would you like to explain this one?
Diphenhydramine is same allergen.
Okay, it's 1 milligram per kg IV with the maximum not more than 50 milligrams. Huh?
Exactly.
So if you have the severe allergy, then you have the adrenaline,
Adrenaline
0.5
first
milligram
choice.
Intramuscular or sub-Q.
Yes.
Okay. So second, you can give the hydrocortisone
5 milligram per kg IV.
Or then third
diphenhydramine.
Okay, diphenhydramine is 1 milligram kg IV, not maximum 50 milligram, not
maximum dose. Yes.
Okay. So in case of anaphylactic shocks, so again you have the adrenalines from 0.1 to 0.05 milligram IV and 1 to 5 mils in
concentration 1 to 10,000.
Yes. And for the children is 1 microgram per kg through the IV.
Yes.
For the hydrocortisone is 5 milligram per kg through the IV, and this is the
diphenhydramine 1 milligram per kg IV. Maximum dose 15 milligram always.
IV fluid loading and CPR and transfusion to ICU and HDO. So time you're shifting the patient. In case of the TACO means transfusion associated circulatory overloads. So treat as cardiogenic pulmonary edema, fusamide,
or
2 to 5 milligram, or we can say Lasix 2 to 5 milligram per kg through IV, and transfer the patient to the ICU or HDO for close monitoring of 24 hours. Then transfusion related acute lung injury is TRALE. Treat as acute lung injury, no diuretics, so you don't give any fusamide or Lasix.
Yes.
Avoid, do the chest X-ray, do blood gas, and transfer this patient to the ICU for close monitoring. Hope it is clear. If you have any questions, please let us know. And Sadiq, you want to add something more in the...
Thank you. You are so good. Thank you.
Thank you so much. Have a nice, good day. Take care. Bye-bye.
Bye-bye.
I will share.